and good afternoon. We're starting our Lunch and Learn today about your inner pharmacy and how you can heal yourself from within. Now, there is a lot of information that I'm going to be giving you today. There's a good deal about prescription drugs, and just to kind of set the stage, I want you to understand that medical errors in prescribing prescriptions have killed over 100,000 people annually, okay? So just to kind of give you some perspective, that's half in the United States, that's half of the COVID deaths, which we're about 200,000 now. So half of that, right, because everybody's all up in arms about the COVID deaths, and rightly so, every death is important. But medical errors in prescriptions, right, 100,000 deaths per year. So what I want to talk to you today is about how your body has an innate ability to heal itself and how it's good for us to be able to tap into that. And there's a book that is written by a researcher. His name is Dr. Jeremy Howick, Howick. And the book is called Dr. U, right? Y-O-U, Dr. U. Introducing the hard science of self-healing. And this is what we want. We want to be able to heal ourselves. Now, we've been doing some information. We've been trying to get some education out there to all of our people. And so I did a timeline of medicine back 2,000 years ago. Okay, so I'm going to kind of read that to you. And 2,000 years it was here, eat this root, right? And then we got sophisticated and we said, no, that the root is heathen. We want to say this prayer. And I'm all about prayer, so don't kind of get me going on that. Then they said this prayer is superstition. That was about 1850. The prayer is superstition, drink this potion. Then about 1940, right? That potion is snake oil. Here, take this pill. Then about 1965, it's that pill is ineffective. Take this antibiotic, right? In about 2000, it says that antibiotic is artificial. Here, take this herb. So we've come full circle in 2,000 years. And so this is what this doctor pretty much is saying, is that we are over-medicating, we are going to the doctor too much, we are not trusting in our innate ability to heal. And so that is really intriguing me, because I absolutely believe that. I will do almost anything to avoid going to the doctor and taking prescriptions, because I innately know that my body is organic and it is going to get well when I take organic substances. It is not going to get well when I take synthetic substances. So I really try as much as I'm able not to do that. Now, of course, if you are having a heart attack, if you have had a car accident, if you are in sepsis, if you have a pneumothorax, I mean, there are certain instances where you need to go to the doctor, you need to have medication, you need to have all the things that modern medicine affords us, and I'm all for that, okay? Barring an emergency, your body has within it the ability to heal. Now, one of the things that you may or may not know is that every cell in your body has an electrical charge, all right? When your body gets older, if your body has had a lot of what we call insults, okay? Now, an insult can be a tragic, I had a car wreck. It can be, I had a divorce. It can be, I had, all this family drama. All of those are insults, and all of those things depress our emotions. When our emotions are depressed, then our body is depressed. At the cellular level, we're depressed. So I like to tell people, look at your cell phone. Every night, I have to plug my cell phone in. Depending on what I'm doing all day, I may have to plug it in before tonight, right? So when your battery goes down and down and down, and then you get the little warning, we need to go into low power mode or low battery mode, whatever yours says, and you get this little red battery. And what that means is none of your apps are going to work. You're not going to get to do anything except maybe text, maybe have a phone call, okay? Because your battery is low. In the same way, our physical bodies get depressed, we get low, and we have to be recharged. So I recharge my body every year. My husband and I do a protocol called RCCP, which stands for Restoring Cellular Communications. And that's just a plug-in. It's a traditional Chinese medicine protocol that we do every year. And we recommend everybody over 50 do it at least once a year. Why is that? Because of the insults that we talked about a while ago, and also because we are getting older. As we get older, we don't perform as well as we did when we were younger. And so this is one of those things that people will say, you're getting older, and so you can expect to have arthritis, you can expect to lose your hair, you can expect to lose your eyesight, you can expect to do all this stuff because you're getting older. I say, no, we don't expect that, right? And if we recharge ourselves, if we recharge our batteries, then we're able to function at a much higher level or at a much younger level, okay? So these are the kind of things that we do. This is what I recommend for you to do as well, because if our batteries are charged, then our bodies are going to know what to do when we have that sniffle, when we have that cough, when we have whatever we have, okay? So I'm going to come to this article and give you some information, and I'm so excited that you guys are watching, and I'm seeing a lot of comments here, so I'll get to those in just a minute, okay? This doctor says, for the first time since World War II, life expectancy is going down in the United States. All right? He says, we do need medicine, but we are taking way too much of it, and we are at the point where it is bankrupting us, and it is not healthy anymore. Now, that's a brave doctor that says medicine makes us not healthy. Okay, that is a brave doctor, all right? He says we are depending on synthetics to heal us when really our body is able to heal itself. The concept of the body as a self-healing organism isn't new. In fact, it's been around for as long as people have. Ancient doctors from around the world noted that given enough time and support, the body will often correct itself. Remember, here, take this potion, here, eat this root. And so we still do that today, okay? It's easier to come to this conclusion if you haven't been immersed in a culture of medicine, all right? So we're in this culture, and you'll see, I don't watch TV very much, commercial TV, right? But when you do watch, every other commercial is about a medication. And they will tell you all the wonderful benefits of this medication. And then they have in very small, what my friend Jean calls bacteria print. Okay, they have this very small print that scrolls across your screen that says you might have these side effects, tell your doctor if, and then they go blah, 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 all that, and including death, okay? So this is what we don't want, the and including death part. And remember, pharmaceuticals account for 100,000 medical error deaths per year in the United States, okay? It says, along with the miracle cures that emerged in the 20th century, there has come an expectation that there must be a pill for every ill, or there must soon be given one, given enough research and funding. This expectation has produced incredible cures, but it has also warped our understanding of what it means to be healthy. I love this. It has warped our understanding on what it means to be healthy. I was talking to a lady at church the other day, and she said that she's healthy. Well, I could tell by looking at her that she wasn't healthy. And then she goes on to tell me all the medications she's on. So I'm going to give you guys a news flash. If you are taking any medication on a regular basis, you are not healthy. Okay, so just going to throw that out there. I'm glad you're taking medication if it's keeping the symptoms at bay and you can get along in your life and do what you need to do. I have a family member that said, my husband is healthy, he just has cancer. Okay, newsflash, You can't be healthy and have cancer at the same time. So we have a misunderstanding about what health is. Today, 20% of Americans take at least 5 prescription drugs per day, okay? Often with little understanding or oversight about how these drugs interact with each other. Now, there is a tool. It is a free tool that you can get on medscape.com, okay? Medscape, medscape.com. You can go to their drug interaction checker and you can put in all of your medications and it will tell you what your interactions are. So we have a lot of elderly people. They come in, they've got 13, 14 different prescriptions, and so I will always run them through the Medscape drug interaction checker. I will give them a printout. I will go over the interactions with them. I will tell them to go to their pharmacist and try and get a different drug. I will tell them to go to their doctor and try and get this straightened out, because we do not want to contribute to the 100,000 medical errors and deaths that come from wrong prescriptions. So the why we have these is because we have such specialized medicine. We've got a cardiologist, we've got a pulmonologist, we've got a regular doctor, we've got a rheumatologist, whatever we have, right? Each of those different doctors are prescribing medicines. Now, if we go to the same pharmacist, the pharmacist is really, really smart in drugs, and the pharmacist should be able to flag and say, okay, Ms. Heil-Mealey, you're not supposed to be taking these drugs together. You need to go back to one of these doctors and tell them you need a different prescription because they're having negative interactions, right? So the pharmacist isn't doing that. You need to do that for yourself because you need to be your own best advocate, okay? So the article continues. Drug researchers look at the body's ability to heal itself more as a statistical annoyance, than a blessing. Why is that? In order to have a drug to be deemed effective, the trials have to prove that it can outperform a placebo. Now, if you don't know what a placebo is a sugar pill, or it is a nothing. It has nothing to do with it. And the medication has to be more effective than the placebo. Now, your best clinical trials are double-blind, placebo-controlled trials. Now, what does that mean? That means the patient doesn't know if they're getting the real drug or the placebo, and the doctor doesn't know if they're getting the real drug or the placebo. It's double-blind. That means nobody can influence the outcome because nobody knows what you're getting. Everybody thinks they're getting the real thing, okay? And then they take the control group and they say, well, you had this % effectiveness. They take the placebo group and they say you have X% effectiveness. So if the placebo group is 60% and the drug group is 60%, then the drug's not going to be licensed because it's no more effective than the placebo. So those percentages are just out of my head. It may be even a lower percentage than that. I don't know what what the threshold is, but the threshold is it has to be more effective than a placebo. All right. There was a study. Now, this just cracks me up because I don't know how they did this. And if I was in the placebo group, I would be pretty ticked off. Just going to say that. But they did in 2014, there was a study at Oxford University that looked at more than 50 placebo-controlled studies of various minor surgeries. Okay, surgeries, that means they cut into you. And they found that the placebo surgery was as effective as the real thing in more than half of the trials. Now, this is really interesting to me because a placebo surgery, I'm not a medical doctor. I've never done that. So I'm using common sense, right, which is not all that common anymore. And I'm using deductive reasoning. If you put me in the hospital and you say, I'm going to do this surgery and your XYZ pain is going to be better, it's not just telling me they did the surgery, but I'm going to have a cut somewhere to prove that they did the surgery, right? So I'm assuming that they just do a little cut, put a Band-Aid on you so you know you've been in the operating theater and all that kind of stuff, and then they're telling you that, oh, how do you feel? Is the pain gone? Do you feel any better? And in half of these cases, the placebo surgery worked as well as the real thing. So that just kind of, that's something to think about, okay? Your brain is really, really smart. It says the placebo effect may also demonstrate how our minds and bodies are naturally bent toward self-healing, okay? No deception is necessary. In a 2016 study from the Harvard Medical School, researchers discovered that even when the patients were told they were taking a fake pill, the ritual of having it prescribed by a real doctor still resulted in significant improvement in back pain. So we are actually told in holistic school that we need to find products that we believe in and that we know work, because if me, the doctor, if I believe in it and if it works for me, I'm going to convey that to you, and it is going to work much better for you by the very fact that you believe me because you trust me, right? And it's going to have a better outcome for you than if I hadn't tried it and if you didn't trust me. So all of that goes into having your body heal itself. So there is a real thing that when you trust your doctor, you do what your doctor tells you to do. I'm ethical. I'm not going to give you a fake pill, okay? I'm going to give you something that I really believe is going to work for you. And we have great testimonials and we have great Google reviews that we get really, really good results. And so that's because we do the research. We look at what we're giving you. We make sure that we have high quality products. I take the products myself. I see that they work for me, okay? Now, just full disclaimer, I can't tell you that I have great prostate formulas that work because I've tried them myself, right? Because I don't have a prostate. But we have people that do the clinical research. We have patients that come in, take the medication. They tell us this is working, so we know that it works. So that is a real thing, to have your trusted professional believe in what they're doing. And that just gives you, because your body, your brain trusts the professional, right? And this is any professional. It's me, it's your doctor, it's your dentist, it's whoever it is that you trust, okay? I would never give you a fake pill. I'm just going to throw that out there. I would never do that. The placebo effect isn't merely a trick of the mind. It taps into what Howitt calls our inner pharmacy, the chemicals with a drug-like effect that are naturally produced in the body. Becoming conscious of our inner pharmacy may make it more effective. One study looking at the preoperative patients explained how much an effect such an insight had on painkiller use. Researchers educated half of the patients, right, about the endorphins of the body's own natural pain-killing chemicals. The other half received no such education. Post-surgery, okay, after the operations, everyone in the non-educated group filled their prescriptions for painkillers. Only 10% of the educated group filled their prescriptions, all right? So, if our inner pharmacy can be stimulated simply by suggestion, why isn't more being done to promote the self-healing mechanism? Harwick believes it's primarily an issue of profit. Now, we know that our medical system is a for-profit system. We know, you probably know, that you can get your medication from Mexico, which I don't recommend. Okay, their criterion is not as stringent as others. Just gonna throw that out there. You can also get your medicine from Canada, which I have had people do that. We know that the Canadians have really, really strict laws with their medications. They have strict laws with their homeopathy, their herbs, and their supplements. In fact, I want to say almost all of my supplements that I have here, but quite a few. My favorite brand okay, comes from Canada. Why is that? Because their legal requirements are much stricter than what we have here. They, for example, on their fish oil, they vacuum pull their fish oil twice to make sure that it has absolutely no mercury in there. So just as a little aside here, if you're taking fish oil, if you're taking krill oil, if you're taking any kind of omegas, you want to put them overnight in the freezer, right? The next day, take them out. If they are cloudy, they have heavy metals in there. And this is one of the things that, because of the pollution in our oceans and that kind of thing, a lot of our fish oil, a lot of our omegas are tainted with heavy metals. Now, we don't want to be ingesting heavy metals. We are ingesting omegas because they are anti-inflammatory. They're very calming to the brain. But if they have heavy metals in them, it takes away that protective mechanism. So you want to take your fish oil, like I say, put it in the freezer overnight. If it comes out cloudy, then you know that you've got some heavy metal toxicity in there. So we purchase the best supplements that we possibly can because we want your inner pharmacy to work for you, right? And we want you to get well. All right, so the medical, the doctor says it's an issue of profit. The medical industry sees the healing potential, not just the market potential. It says, if you work at GlaxoSmithKline, which is a pharmaceutical company, they have an amazing cafeteria with healthy food, way healthier than you would ever find in any hospital, he said. They teach mindfulness, they teach yoga, they have programs that help the workers to keep their workers from taking drugs. But their business model is for us to take more drugs, okay? If you are going to a medical practitioner, if you, say, have diabetes, I know this is true. Once you have diabetes labeled on your chart, your insurance company knows that you have diabetes, your premiums are going to go up, you're going to be on metformin or whatever they give you, and you're going to be on it for life, regardless of what your sugar is doing. Now, to be fair, in the medical community, right, once you have diabetes, they never see it reversed. We know that we can reverse diabetes through holistic methods. One of our main challenges is working with the physicians and working with the patient to say, we're going to put you on this protocol. We're going to get your body functioning the way your body needs to function, but you need to be very mindful about your glucose numbers. You need to be very mindful about taking your glucose every day. Why? Because you're on your medication to keep your glucose in check. As your body starts to heal, as your body starts to metabolize the glucose better, you're not going to need as much medication. And if you still keep taking the medication that you were taking before, medication only knows one thing, what it is designed to do. So we'll say metformin, for lack of a better example. Metformin is to suppress blood sugar. But if your blood sugar is in already a normal range and you take metformin, it's going to suppress it even lower than it needs to be. And what's going to happen? You're going to have a blood sugar crash because you have artificially suppressed your blood sugar when we have your pancreas working the way it needs to, right? So when you are working holistically and you're taking medications, you have to be very, very mindful because we know how to get the body to work the way it needs to. And as your body works the way it needs to, you're going to need less and less synthetic support. And your doctor should say, oh, your glucose reading was 85 this morning? Okay, good. Don't take your insulin today or don't take your metformin today. But because they don't see that in their practice, they're going to think it's an anomaly. They're going to think it's an aberration. They're not going to think it's the real thing. So this is one of the things that we wrestle with. We wrestle with this with our kidney patients, people that come in that are in kidney disease, all right, chronic kidney disease. The medical people never see that reversed. We see it reversed all the time. And so when someone comes and they're in a very depressed state, they're already doing dialysis, all that kind of stuff, we tell them, Make sure that your wet weight and your dry weight, right? Make sure that you're mindful of that, because we have seen far too often they go to dialysis, the technician does what they're told to do, and they take too much fluid off the patient because the patient's kidneys are working so much better. And then they have to give them an IV because they've taken off too much fluid, right? So this is one of our main things that we have to deal with the medical profession, because they never see anybody get better, right? Once you're a diabetic, you're always a diabetic. Once you're in chronic kidney disease, you're always in chronic kidney disease. And that's just not so with the people that we deal with. So I didn't intend to get off on that little tangent, but I did. So somebody must have needed to hear that. So if that's you, just let me know that, hey, Dr. Polly, thanks for saying that, because I really needed to hear that, all right? Where was I here? It says diet and exercise are well-established strategies for improving our health, but there are many other things that we can do to influence our well-being. We can keep close friends. We can have gratitude. We can cultivate a positive outlook. Perhaps part of us have always known that such behaviors were good for us, but recent science is bringing clarity to their therapeutic value. Now, this is one of the things that really upsets me about the season that we are in, because with the COVID crazy, right, we're told to separate ourselves, keep 6 feet distance apart, don't get in groups, don't go see your family, all that kind of stuff. And that is wrong, okay? We have to cultivate those relationships in order for us to be healthy. And so I want you to be healthy, okay? I'm going to go just about out of time here, so I'm going to scoot down to this place. It says, when facing a serious health problem, consider the evidence behind the suggested cure. Aggressive cancer treatments, for example, are often the first choice among patients desperate to save their lives. They rarely realize, these are the patients rarely realize, however, that these harsh procedures were never approved based on trials where they look at mortality as an outcome. So what does that mean? Let me get that in real English for you. When you have cancer, and I've been through this with my mother. I went through this with my late husband, okay? This was long before I knew anything about holistic healing or holistic health. I did not know that there were options other than the traditional chemo, radiation, cut it out. I did not know, right? When you have a cancer diagnosis, they will tell you, this is the protocol, this is what you need to do, and this is what you need to do today, okay? Now, just so you know, all right, chemotherapy only works on 3 cancers. Childhood leukemia, all right, testicular cancer. I'm never going to have those 2, because why? Well, I'm too old for one, and I'm the wrong sex for the other one. Even if I happen to identify as a male, I would never have testicular cancer. That was a joke. The third one, non-Hodgkin's lymphoma, actually does respond to chemotherapy. However, within 10 years, you probably will have a secondary cancer due to the chemo and radiation, okay? Just gonna throw that out there. That is on American Cancer Society letterhead. So you can Google these documents, you can find it out there. So those 3 cancers do respond to chemotherapy, but there is a very high risk of a secondary cancer that won't within 10 years. They never tell you, and according to this article, these procedures were never approved on the basis of mortality, meaning if you do the chemo, if you do the radiation, you're going to live longer. No. If you do the chemo, if you do the radiation, it's going to shrink the tumor. It's going to do whatever it's going to do to the tumor so they can take it out. But it has residual effects on you as a human being. This is what people are not being told. So we try and tell you these things. Modern medicine, I'm going to leave you with this because I'm out of time. Modern medicine can rescue us from extreme circumstances, but for general health maintenance, okay? Seek modalities that work with your body's self-healing systems, okay? So I'm going to leave you with that. It is the weekend. We are well and truly into fall today. This week, I think it was the 21st, whenever it was the first day of fall. So we are heading into a different season. I know here in South Texas, it's hot and hotter. Those are pretty much our two seasons, but it is getting cooler, and so we're thankful for that. Take care of yourself this weekend. Practice self-care, and I will see you next week. Love you. Bye.